Okay, so I think now we can jump into some questions. We have quite a few, which is really good. Okay, so Phil, I'm going to come to you first. What has been the impact on the Irish nursing workforce of their government's action in holding back agreed wage increases?
Thanks, Laura. Very interesting. Thanks, Jim and Brett. Really fantastic presentations. What has been the effect? The effect has been that the structure of work has changed considerably. And we were just beginning to bring that round to where we now have a mechanism for setting staffing levels in the public sector, in the surgical and medical wards. You have your mandated levels, I think, in New South Wales. If I had a magic wand, I think legal minimum staffing levels have to be in place, because when you interfere with wages, you interfere with levels of staffing. That's bad for patient outcomes, and it's really bad for the workforce. We had a massive increase in our agency. So most of our rosters were supplemented with agency. We were spending €1.5 million a week on nursing agency up to 2 months ago. What's that in Australian dollars? About 2.4 million, $2.5 million a week. And you know what happens. You know, you have some days you don't have enough, other days you have a really poor skill mix. You might have lots of good staffing levels on a Sunday when you have a higher premium, but very little on a Saturday. So the rostering and the patient load just became enormous. One of the worrying statistics that emerged was our assault on nurses increased significantly. And of all of the healthcare workers and of all of the frontline workers, the general nurse assault figures were higher than psychiatry, higher than some of our mental health nurses, traditionally where the higher rates of assault were seen. So we saw this trend of health and safety issues emerging, which we directly link to staffing levels, and staffing levels, low wages. As Jim set out, you know, we were the low wage economy, and the caring professions, once it started in the public sector, we then had very low wages for the other caring professions in the private sector, home helps, for example, and then you just could not fill those posts, and patients became acute. When their acute phase of their illness was over, they remained in the acute hospital because there was nowhere to go. And we still have a huge problem with availability of beds outside of the acute hospital. And the overall effect is that a lot of nurses felt, and midwives felt, that they were underappreciated, obviously. I think when we campaigned on the recruitment and retention on the basis of nursing ratios means good care and better outcomes for patients, our members felt that that was the right tone and message. And the public got behind it quite significantly. We had a march through our capital city here in February, and 50,000 people came out to join, which is, you know, in our terms, that's quite a large support. We do have public support. I think the pandemic again shows that the impact of good nursing care again, the patient outcomes are better. Like our ICU discharge right now is quite high, very impressive, all about nursing care, all about the types of nursing research, prone nursing, etc., how you nurse your patient during an attack like this virus. Our care of the elderly services have been decimated. There are statistics this morning on our news where we are actually just behind Canada, it seems, as the highest rate of death in care of the older person. And some countries record it differently, but that's the stat. And we have not been able to staff our care of the older person services. 82% of it has been privatized during this recession, very low wages, minimum wage in the main, and that has had a direct impact on education, infection control, and patient outcomes. So all of that combined, I suppose the only message I can really re-emphasize is you have no choice. You have to campaign against a wage freeze. It is only the first step, and it's a test. And if the government believe that they will not meet resistance, they'll go to the next step. They always do. And some people get very concerned around, job security, etc. I think in our world, we have to be confident enough to understand that the skills we have, the global skills we hold, that that job security is very important. Of course, it's important, but our jobs are equally as important as economic jobs, as IT jobs, and we just have to use language that describes why patients suffer when you interfere with your ability to retain as well as recruit. And they're both important. I hope that answers the question, Laura.
Sure does. Wow. Thanks for that, Phil. And thank you, Stephen, for that question. I think far out. I think I'm blown away just as much as you guys are. So Jim, I'm going to come to you now. So Susan's asked, how does a wage freeze create jobs and who are they created for?
Well, there's an easy one to answer, Laura. Point A, they don't create jobs. So point B, they're created for no one. All you do with a wage freeze is limit how much spending power nurses and other public servants have in their pockets. In fact, in a situation like this, they will destroy jobs. Now, the government, of course, is justifying this wage freeze by claiming that there's a trade-off, that it means they'll have no forced redundancies for the year. And this is the sort of devil's choice that they're trying to present to public servants. And that is an absolutely false choice and should absolutely be rejected as the dichotomy. First of all, be aware of your power. There is no way they can make forced redundancies of nurses and healthcare workers and other essential servants. You're saving society right now, and society knows it. So don't believe that A, there's no need for your services. Of course there is. And B, that the government would dare to go around laying off public servants in the healthcare or any other essential field. So you've got power on that score. And it's an absolutely false choice. There's no need for government to do either of those things. And in fact, it's essential that they don't do either of those things. You have a moment where Australia is now in a recession, the first recession in about 30 years. And by early indications, the decline in output and employment has been as bad or worse than it was in the Great Depression of the 1930s. So this isn't even a regular recession, which is unusual for Australia. It's more like the potential beginning of a depression. And the key responsibility for government at this time is to act as the overseer of the overall economic situation. And governments are the only ones with the financial resources and the capacity to plan and the size that is essential in order to help the economy get out of this hole. And the sort of knee-jerk austerity that we saw from this government will only make that hole deeper. So short answer, no jobs will be created by this. And if anything, it will, as I said again to ABC yesterday, it risks turning this recession into a depression.
Thanks for that, Jim. I'm going to stay with you, Jim, actually. I've got another question here from Michelle. Some small businesses are happy with the freeze, stating that any wage increases in their sector will cripple them. How does she respond to this statement?
Well, again, sometimes you have to wonder what planet people are on when they're asking you questions like this. With all due respect, I don't know what kind of small business it was, but if it was a small business that depends on consumers coming in and shopping, I mean, after all, these are businesses that have been starved of consumers in many cases because they've been shut down in order to help protect public health. So the idea that consumers having more money is somehow bad for a small business astounds me. Obviously, the key factor determining whether a small business can succeed or not is how many customers it has and what its market is and if it can sell its goods or services. And I always find this end of it amazing. We saw this same, in a way, contradiction with the debates over penalty rate cuts. For some of you will remember when the Fair Work Commission accepted, again, the same kind of knee-jerk argument that if you got rid of or reduced the penalty rates for working in retail stores or cafes and restaurants on Sundays and holidays, somehow that would make those things cheaper, and somehow more people would come out and go shopping and go to cafes. And it's nonsense. In fact, there's no sector of the economy that's more dependent on the consumer spending power of Australian workers than the retail and hospitality sector, where there are tens of thousands of small businesses. So this again is where I think the union's argument can be stronger as we position it as something that's good for all of society. It's not just protecting our own members, which we have every right to do. We're also protecting the interests of the whole economy in a working population that has secure jobs and money to spend. And there's no more powerful force to get us out of this recession than a working population that has secure jobs and money to spend.
Thanks for that, Jim. Okay, so Brett, we're coming to you now. And Donna has asked, how do we impose strikes or make a stand without putting our patients at risk? How do we make an impact without affecting our colleagues?
Well, there's the hard question. Can you make a strike without having an impact? We've had a long tradition of when we've taken those rare actions that we've left behind skeleton staff, and we've always tried to make sure that we couldn't be blamed for the death of patients. And I'm pretty sure that our members would make that decision carefully again. I think there's a place for industrial action, and it's one that we've used fairly rarely. But it's one that has to be supported very strongly right across the membership. So before I go out declaring that we'll actually go on strike, I need to know that the branches have used their democratic power to decide that that's what they're prepared to do. And I need to be assured that there will be an impact. There's little benefit in a hospital with 2,000 members and 10 people out on the grass on strike for a few hours in a day. That's really not going to convince the government that they've got a problem. So you need to make sure that it's widely, deeply felt and that people are prepared to take some risks. They're prepared to say, we'll do the very best to preserve life, but we're not going to continue to do business as usual. We're in a very difficult position in a pandemic about having, to be put in this position of even thinking about withdrawing services. Fortunately, we don't have many COVID-19 patients in hospital, and as a result of that, we also have lots of empty beds. And the other problem there is, of course, lots of casuals without work. So I'm pretty sure that if we said we were going on strike, then there'd be probably plenty of casuals who might put their hand up to come back to get a few dollars to survive on. So we won't rule out strike action, but the first and most important thing is that we continue to place support behind those politicians who are saying they're going to do the right thing by us, and that we show very strongly to the government that we will stand firm with our brothers and sisters in the other unions, and we've been doing that. Of course, many other public servants have been subject to job losses, so their members are very attuned to the risk that they take with the government of further privatisation of their jobs or just cuts to their services. So we're working with the rest of the public service unions to make sure that all of our voice is heard, and that we're encouraging them to come along with us for this campaign, and to maintain that solidarity. It's never easy, of course, when the government is trying to juxtapose jobs versus money, jobs versus wage increase. Then we've got to stand firm and know that, like Jim said, nurses and midwives, they actually need more of us, not less of us. And we've got to stand firm about that and encourage our fellow public sector workers to stay strong and stare down this government. They're making a bad decision. And we need to keep saying that to the community, to everyone that you can talk to. You've heard the economic argument tonight. It's a strong and powerful argument about how do we spread money through our community the quickest possible way. Government says it wants to spend money on infrastructure and somehow create the hundreds of thousands of jobs that have been lost. But hundreds of thousands of jobs don't go into infrastructure, and they don't go in tomorrow. They don't start spending the money from the first pay period in July, when you should be getting your 2.5%. That's the problem. And you know, the longer term impacts that you see about reduced spending power. You know, the austerity message flows from government to workers to other employers. The private sector says we'll impose it, as you've seen on those graphs, and it just keeps cascading into a downward spiral. So stay strong with us. We will be talking to our members at the appropriate time about whether strike action is necessary. Right now, we've got a little bit of an opportunity to get government to do the right thing, or at least get our members of parliament to represent us properly in the upper house and strike down this proposed regulation from the government.
Great, thanks, Brett. So now I'm mindful of time, but I've got one last question, and I'm going to come to all three of the panelists with this one. So Phil, I'm going to start with you. The question is, I've been speaking to staff members about the wage freeze, and some staff have stated that we should be grateful we have a job, or should we accept the wage freeze for the greater good? How would you reply?
Without being smart, I think that's crazy. I think the important thing for nurses is we never, ever get a wage increase that values our worth, largely because we're female-dominated professions. The gender pay cap is really alive and well in this part of the world, and a pay freeze is the last thing that should be accepted, and it shouldn't affect your employment. As I said earlier, you have when you look at the rules and the laws of supply and demand, right now, the nursing profession and the midwifery professions are the single largest global skill that is so very, very short. And why would we be accepting that cutting our wages is the right encouragement? Why would we be accepting that we have no value other than an economic value that values us lower than many in other professions who are paid higher? In our country, we are paid almost 7% less than other allied health professionals. Our hours are longer. And when we examine that across the world, it doesn't actually change that much. So comparatively, nursing hasn't reached the same level of pay as other healthcare professionals. And that's wrong. It's simply wrong. What we do in our levels of education should be valued. And now with the supply and demand argument, our argument is stronger and we need to use it. If I may just very quickly say on Brett's wrap up about industrial action, you're absolutely right. It is always the last step in the game. And public campaigning and organizing public campaigns, your union is really good at that. We do that. We're an organizing campaigning union. And many times we've looked at the New South Wales experience and adopted some of your strategies. And that's what, you know, those are the steps. And when it comes to it, when members understand that they have no choice, the thing I am most proud of is in all of the strikes we've had, the central protection of the patient's experience, even during a strike, is amazing. It's just incredible. And we had a national strike, as I said, in January and February 2019. And we managed to bring the health service to a near halt. And the election campaign that we've just had, for the first time in a long time, the health agenda was number one. And we forced it there. And that's what you have to do. Our story is the public patient who is dependent on the public health services story. It's the same story. They'll support us when we support them.
Great, thanks, Phil. So Jim, how would you answer this question?
Well, again, I'm struck by the irony of somebody saying to a nurse, do something for the public good by accepting a wage freeze. The nurses are putting their lives on the line for the public good every day, first of all. So again, take pride and take some power from the role that you play and the strong public recognition of the role that you play. But even in economic terms, if you want to do something for the public good, standing up to a government that's guided more by ideology than economics and wants to freeze wages for you so that they can then freeze wages for others and cut taxes and generally, deliver the spoils of economic growth to those who are already doing very well. Standing up to that is in fact an act for the public good. And if nurses and other public servants are able to stand up and, first of all, win the argument, which I think we can, that a wage freeze is a perverse, self-destructive response to this recession. We tried it in 1931. We froze wages. We even cut the minimum wage. And we ended up with a decade of depression afterwards. We have to learn from that mistake. If we can win that argument and then use the organized power of our workers and the union to push back the government's knee-jerk reaction here, then we are absolutely defending the public good. I can't think of anything more that we could do to defend the public good, but win an argument showing that workers deserve to be paid the value of the services that they provide. So more power to you and good luck with that campaign.
Thanks, Jim. So Brett, I'm going to come to you with this question now.
Well, Laura, I think Phil and Jim have answered that really powerfully. Nurses and midwives are doing the public good. They've stood in front of this disease with so much unknown, and we're now seeing with so much risk. I start to see photos of this wonderful new PPE that the Premier has said she's delivered to health workers as part of the bonus that she's looking after health. Well, unfortunately, some of it's counterfeit and it's not fit for purpose. And, the government has been patting itself on the back about this equipment, but on recent exposure, I have grave concerns. And we've been trying to work very cooperatively with government, with the Ministry of Health, to make sure that you could do your jobs as safely as possible. But in their haste to return the economy, they've been buying some pretty dodgy stuff at the moment. So we'll need to make sure that that's corrected. You have been doing the public good. You don't need to step back at all and think that you've got to make more sacrifice for the community or for this greater good. You are making the sacrifice, you're turning up to work, you're taking the risk, you've done the hard yards, and you've been doing it for years. Your productivity has been escalating year on year. We're seeing more patients with the same number of staff, and we've seen, you know, great efforts being undertaken by nurses. So you should never feel ashamed or obliged to say that you've got to take one more for the team. You've taken it already. It's time that you played your part in the economy and had the capacity to go out and spend so that those unemployed hospitality workers can get a job back, so that those retailers can actually sell some product and get the economy back in shape.
Great, thanks, Brett. And thank you to all our panelists. We're going to have to wrap it up now, but what an amazing webinar. I really want to just thank you all again for being here today. I think we've gained a massive amount of knowledge, which is, you know, always a powerful thing. So now it's over to you, the members, the nurses and midwives of the public sector. We have a short time frame to get this issue in front of the MPs and the upper house. We need you out in your workplaces talking to your colleagues, letting them know that this is a terrible idea of the government's. We need you to turn that conversation into action. Email your local MP and the upper house. You can do this via our website. Lastly, let's show this government that we mean business, that the nurses and midwives of New South Wales will not lay down and take this, that this decision is the wrong one. Come with us next week to display your level of disgust at this. We have an all-day event outside of Parliament House on Tuesday, the 2nd of June. We will also have regional and outer metro areas rallying outside their MP's office and outside their hospitals. So if you want to join us on any of these events, please contact your local branch or call or email the association. All of these details are available on our website. And lastly, once again, if you are not a member of ours, please join. Please Google NSWNMA, go to our website, join now. We need you in on this fight. So for those of you who want to share the video that we put up earlier, it's now in our Facebook page. And like I said, share away, spread it far and wide. And this recording is going to be made available in Member Central. So thank you to you all, and I hope you have a really lovely evening.